Stop scrolling for a moment. Listen closely. This is important. This could change your life or your parents' lives. Imagine this: a hospital. The doctor smiles kindly and says something I've heard so many times as a surgeon. Don't worry, it's just a routine procedure. Routine. It sounds harmless, but it can be deceptive. It might be routine for the doctor, but for your body, it can be a fight for survival. After 75, the body works differently. Many people still look good, go for walks, shop, and seem healthy. But inside, things are breaking down. Muscles are weakening. We call it sarcopenia. It's a technical term, but the reality is serious. Sarcopenia means your body doesn't have backup resources anymore. Muscles aren't just for moving. They're like airbags. They keep your blood flow steady, store power, and support your immune system. Without these reserves, your body is defenseless. Any stress hits hard. Any surgery becomes risky. Nerves change too. The coating around your nerves, called myelin, gets thinner, like old electrical wires. Signals skip, slow down, and sometimes cause a mess. In surgery, that means the brain is more sensitive to anesthesia. Some patients wake up and don't recognize anything. Voices sound strange. Faces look scary. This is called delirium. For the family, it's like their loved one has changed. Then there's your metabolism. Many older people develop insulin resistance. It might not sound bad, but it's dangerous. Cells barely respond to insulin. Sugar stays in the blood, but cells are hungry. They lack power. Muscles, nerves, brain, they're all starving. At the same time, blood vessels get clogged, like rusty pipes. This means worse blood flow, which means slower healing. Now, imagine this body on the operating table. Anesthesia, blood loss, stress hormones, swelling. A young body can usually handle it, but an older body doesn't have backup. The heart goes wild, the lungs struggle, the brain gets confused, and things suddenly go downhill. I've seen people walk into the hospital and never go home again. It's a reality that hardly anyone talks about, not because they mean to be mean, but because no one likes discussing risks. But I'm talking about it because some surgeries are risky after 75. They might be technically routine, but they're hard on a weak body. I'll tell you about 5 surgeries where the risk is especially high. First, you need to know where the danger starts. Not in the operating room, but long before, in daily life, often without you noticing. Listen carefully. The problem rarely starts with the surgery itself. It starts weeks or months earlier, with small signs that almost everyone ignores. Weak legs, dry mouth, dizziness when standing, brief confusion. Many people say that's just normal for old age. But that's where the danger lies. When muscles weaken, the body loses not just strength, but also balance. Sarcopenia makes blood flow unsteady. The body has fewer protein reserves, and the immune system is weaker. Without muscles, the body is like a house without support beams. Then comes insulin resistance. Cells don't react to insulin properly. Sugar stays in the blood, damaging blood vessels. You could say they rust. You can't see it or feel it, but it makes every surgery riskier because tissue with bad blood flow heals slower, and bad wound healing means infections, problems, and long hospital stays. At the same time, the nervous system changes. The nerve coating gets thinner. Signals become spotty, like old, worn-out wires. Short circuits, slow reactions. After surgery, the brain can get overloaded. Patients wake up and think they're trapped. Some try to get up, pull out IVs, and fall. That's where the vicious cycle begins. A fall leads to immobility, which leads to lung problems, which lead to infections, which lead to the ICU. Many people go to the hospital for surgery, and suddenly a chain of events starts that no one wanted. A quiet chain reaction in the body, weakness, surgery, problems, immobility, need for care. That's the danger of old age. But there's another truth that hardly anyone talks about. Not every surgery saves lives. Sometimes surgery is more dangerous for a weak body than the illness itself. That's why we need to talk about 5 specific procedures, surgeries, where the risk goes up after 75. One of them affects hundreds of thousands of older people every year. If you or your family are affected, you need to know this. Stop scrolling. Listen closely. This is important. Many people think the biggest risk of surgery is the cut itself. Wrong. The real risk starts much sooner, in the system itself. A system that's good at surgery but often realizes too late whether the body can handle it. You go to the hospital. Blood tests, EKG, maybe an X-ray. Everything looks okay. The computer shows normal readings. Then you hear that sentence again. You're fit for surgery. But that can be misleading, because standard medicine often measures only what's easy to measure: blood levels, pulse, oxygen. It rarely measures what really matters: the body's biological reserve, the strength to handle stress. That backup fades faster in old age than many doctors want to admit. Sarcopenia, remember? Muscle loss. In the statistics, it's just a term. For the body, it means no more shield. A patient can seem stable on the outside, but already be frail on the inside, as we geriatric doctors say. A body that collapses under the smallest strain. That's where the system fails, because no lab tells you how much muscle power a person really has. No blood test shows how steady their nerves still are. The nerve coating is rarely checked, yet it decides how quickly the brain recovers after anesthesia. When the coating gets worn, the nervous system gets glitches, short circuits, flickering impulses, confusion, fear, delirium. While the brain struggles, so does the metabolism. Insulin resistance, a word that's often ignored, but describes a state that messes up the whole body. Sugar is in the blood, but cells don't respond. Power doesn't arrive. Think of an engine that has gas, but the lines are blocked. That's how the body feels. muscles without power, nerves without power, immune system without power. When surgery comes along, this fragile state falls apart. The system often notices only when problems arise: an infection, pneumonia, delirium. Suddenly, the patient is in bed longer. Muscles weaken even faster. Blood flow becomes unstable. A vicious cycle starts, and many families don't understand how it happened. They say, "But the surgery was successful." Yes, maybe technically, but the body paid the price. That's why we need to talk about something that surprises many people. Surgery isn't always the best answer, and not every illness needs to be operated on right away, especially in old age. I'll show you 5 procedures where this decision can be crucial. First, you need to understand a deeper truth, hidden in the body itself, in a subtle biochemical process that decides whether an older body gets better after surgery or not. Listen closely. This is going to be important. Many think aging is just about age. Wrong. Aging is a biochemical process, a process deep inside your cells. One of the most dangerous things is glycation, a complicated word, but the idea is simple and worrying. Imagine sugar in the blood as sticky syrup. This syrup sticks to proteins, blood vessel walls, and nerve cells. Over time, it forms firm, rigid structures. Blood vessels lose their stretchiness, like old water pipes full of rust. Rust in the vessels means worse blood flow. Worse blood flow means less oxygen for organs. When a surgeon cuts tissue, that tissue suddenly needs maximum supply, but the lines are already damaged. At the same time, the nervous system keeps changing. The nerve coating is attacked by stress and swelling. When it gets thinner, signals in the brain slow down. Some nerves overreact, others go silent. Rigid nerves develop, lines that don't work right anymore. That's why older people are so sensitive to stress. Surgery isn't a small thing for the body. It's like a biological storm. Swelling spikes, stress hormones surge. The body has to repair, heal, and renew. If mitochondria, the powerhouses of cells, are still strong, it can do it. If they're worn out, energy runs out. After surgery, patients feel not just weak but wiped out. Each step costs power. Each breath gets harder. The immune system slows down and bacteria have an easy time. That's why we geriatric doctors talk not just about age, but about biological age. 2 people can both be 80. One goes hiking, the other can barely climb stairs. The difference is deep in the metabolism, in the vessels, in the nerves, in the cells. That's where the solution lies too. If you understand these processes, you can change them. You can ready the body, strengthen its backup, and improve the chances of surgery. But only if you act in time. I'll show you something many people underestimate before surgery. A simple way that can make the difference between a body that collapses and one that recovers. The best geriatric doctors use this strategy. Wait a minute, don't scroll any further. Listen closely. This is about life and death. I'm not kidding. Most think surgery is the moment of truth, but that's not right. The truth starts much sooner, weeks, sometimes months before. The body decides long before the first cut whether it can fight or not. When an older body goes into surgery without getting ready, it's like a car driving on the freeway without oil. It might drive a few miles, then the engine breaks down. That's what happens with many patients over 75. Sarcopenia eats away at muscles, Insulin resistance blocks metabolism, and nerve insulation gets thin. Suddenly, only short-circuited wires work in the body. Signals come too late, muscles react too slowly, and the heart has to pump harder. The vessels are already damaged. Then comes the stress of surgery. The body has to repair, heal, and renew. But without backup, it's too much. That's where the strategy I want to tell you about comes in. It's called getting ready. We call it prehabilitation. It's a hard word, but the idea is simple. The body is trained before it's operated on, not after, but before. A prepared body reacts differently to stress. Muscles are turned on, metabolism steadies, and the powerhouses of your cells make more energy again. Even the brain reacts more steadily to anesthesia if the nerves are well supplied and the insulation doesn't fall apart any further. Specifically, a body with muscles handles blood loss better. A body with steady blood flow fights infections faster. A brain with working nerves gets delirium less often. Listen closely. It's not just about exercise or food, it's about time. The body needs weeks to build back up. If someone starts the day before surgery, it's too late. The damage is already done. That's why people over 75 need to ask something that's asked way too rarely. Does this surgery really have to happen right now? Or can the body get ready first? Many procedures allow this preparation, and these weeks can make the difference between a body that collapses and one that recovers. But that's not all. Even the strongest body can be in danger if a single decision is wrong. That's why we need to talk about something every patient should know before they go into surgery. Stop for a second, take a breath, and listen closely, because this is about your most important weapon: knowledge. Many go into the hospital with blind trust. They think the doctor will do what's right. Sometimes they do, sometimes they don't, because doctors work under pressure too. Time pressure, clinic pressure. That's why patients need to get involved, especially after 75, because it's not about age, it's about the state of the body. A body with sarcopenia, insulin resistance, and weak nerves reacts differently than a trained body. Two people, both 80. One walks 5 miles a day, the other barely gets out of the chair. On paper, they're the same age. In the operating room, they're two different worlds. That's why you have to ask questions. Hard questions, direct questions, questions many are afraid to ask. What's my personal risk? What are the other options besides surgery? What happens if we wait? Most importantly, how do I ready my body? A good surgeon will take these questions to heart. They'll tell you whether your body is ready or not, because sometimes surgery is the only chance. Sometimes it's braver to wait and strengthen the body first. That's where the future of many older patients is decided, not just in the operating room, but in the weeks before, when muscles are built, metabolism is stabilized, and the brain is protected. When the rust in the vessels is reduced and the nerves get energy again. A body that's ready fights differently. It heals faster, gets up sooner, and leaves the hospital on its own 2 feet. There's one last point that almost no one mentions. Surgery can be successful, yet still change your life. That's why we need to talk about 5 surgeries that older people need to be careful about. One of them affects hundreds of thousands of families every year. If you or your parents are over 75, you need to understand why this procedure can be so dangerous. Stop. Don't scroll any further. This last part might be the most important. Listen closely. This is vital. Many think the most dangerous decision happens in the operating room. Wrong. The most dangerous decision happens before that, in a quick chat, in a room with fluorescent lights. A doctor looks at the file, a patient nods, and then a sentence is spoken. We're going to operate. At that moment, many think there's no other choice. That's where the most important truth starts, and hardly anyone speaks it. Surgery doesn't always lengthen life. Some surgeries only lengthen the fight, and the body decides how that fight goes, especially after 75. At this age, the body no longer works with big reserves, but with what's left. Sarcopenia, remember? The loss of muscles. This doesn't just mean weaker legs, but less energy, less protein, and less protection from swelling. A body without muscles is like a house without support beams. A small storm can make it collapse. Then there's insulin resistance. Sugar in the blood, but no energy in the cells. Imagine your body is facing a huge job site, healing a surgical wound, but the workers have no fuel. That's what happens with many older patients. While the metabolism fights, so do the nerves. The nerve coating gets thin, signals slow down, some disappear completely, others shoot through the system like sparks, short circuits in the brain. That's why confusion, fear, and delirium happen so often after surgery. People wake up and no longer recognize their family. Voices turn into noises, rooms seem strange. For relatives, it's a shock. For the body, it's a sign that the nervous system is overloaded. At the same time, the vessels are often already working at their limit. Years of blood sugar, swelling, and stress leave their mark. Rust in the vessels, rigid lines, bad blood flow. Then surgery suddenly needs maximum supply for the tissue. Oxygen, nutrients, repair stuff. But the lines have gotten narrow and supply is lagging. That's exactly why older people need another kind of decision before surgery. Not a quick agreement, but clarity, courage, and questions. Listen closely. 3 things can save your life. First, know your condition. Not the age on paper, but the age in your muscles, your vessels, your nerves. A body with sarcopenia reacts to stress differently than a trained body. Second, give your body time to get stronger. Weeks can make a big difference. Muscles can come back, the metabolism can get steadier, and swelling can go down. Third, ask the question many don't ask. What happens if we don't operate? Sometimes surgery is life-saving. Sometimes it's just one of several choices. A good doctor will answer honestly, because in the end, the decision is yours, your body, your life. In 30 years as a surgeon, I've seen a lot. People who seemed too weak and fought amazingly hard. And others who seemed stable and suddenly collapsed. The difference was rarely in the scalpel, but in the condition of the body before surgery. That's exactly why knowledge is your strongest medicine. If you understand what's happening in your body, sarcopenia, insulin resistance, worn nerves, rust in the vessels. Then you see the risks more clearly, and you can act smarter and more calmly.